This is a 33-year-old African-American male who recently traveled to Central America 5 weeks ago, presents to the clinic with yellow coloring to the whites of his eyes and fever.
All right, so 5-minute differential start now.
Okay.
Okay. All right, so my differentials are gastritis, hepatitis, hyperbilirubinemia, drug-induced food intolerance, lactose intolerance, hepatocellular carcinoma, carcinoma of the liver, cholecystitis, obstruction of the bile duct, medication related, cirrhosis of the liver,
Mm.
and pancreatitis. All right.
Okay.
I'm good. I'll perform hand hygiene and knock on the door. Hi, my name is Peter. I'm a nurse practitioner student. I'll be taking care of you today. Can you verify your name and your date of birth, please?
My name is Charles Xavier, and I'm 33 years of age.
Thank you for verifying your name and your date of birth. So what brings you to the clinic today?
I've been like not feeling great since I came back from my trip about like 5 weeks ago. I've got like, I don't know if you noticed, but like yellow, looks like there's yellow in my eye. And I've had like a fever and my stomach doesn't feel great.
You said that you went on a trip 5 weeks
Mhm.
ago. Did you eat anything unusual on the trip or in the past week?
I mean, like we went off into the city for a little bit and definitely tried like some different foods. And like I didn't, I kind of drank the water and stuff there. So yeah, I don't know.
Okay. Do you remember anything you ate, like anything raw?
I think a lot of the dishes had like raw veggies with them. I think they like cooked them a little bit, but like not a lot. Um, some raw shrimp.
Mhm.
Um, yeah, stuff like that, and then a couple of dishes like that.
You mentioned that your stomach doesn't feel well. Did you have diarrhea or anything?
Yeah, definitely for like the past week, I've had like diarrhea. Been feeling like super nauseous, not really wanting to eat much. Um, yeah, that's been really bad.
Did you notice any blood in the diarrhea?
No, not that I saw. No.
Okay. When did you last have diarrhea?
I'd say this morning.
Okay.
Yeah.
Were you also vomiting when you were nauseated?
No, not really vomiting, but like just a lot of nausea, like feeling like I want to throw up.
And do you have any pain right now?
Yeah, in kind of like this part of my stomach, like the right side, I guess like what's that? Like the top side of my stomach or the upper side, I guess. A lot of like pain there.
And okay, when did the pain start?
So I guess I've had the pain I think since I've had like the nausea and diarrhea, so I guess about a week.
Okay. On a scale of 1 to 10, 10 being the worst pain you ever had, how would you rate the pain?
Definitely like a 7 or 8 at times. Yeah.
And how would you describe the pain? Is it sharp? Does it come and go? Is it like constant throughout the day?
I guess it feels kind of constant, kind of achy sometimes.
Is there anything that makes the pain worse?
Um, Not that I've noticed. I guess definitely when I have like the bouts of nausea and diarrhea, it doesn't feel any better.
Okay. Is there anything that makes the pain better for you? Have you tried anything?
No, I haven't taken anything.
Okay. And has this ever happened before? Have you traveled somewhere and had this kind of pain, nausea, or diarrhea?
No, not really. I feel like this is the first time.
Okay,
Mhm.
first time happening.
Yeah.
Besides the abdominal pain you said to the right side, do you have pain
Mhm.
anywhere else?
No, just there.
Any fever or chills?
Yeah, definitely been having some fevers.
Mhm.
It doesn't feel like a super high fever, but I can definitely tell like my temperature's up. I don't feel well.
Do you notice any weight changes? Did you lose weight or did you gain weight?
I feel like maybe I lost a little bit because I'm not eating as much. But Nothing significant.
Okay. And you said you had yellow in your eyes. How about your skin? Do you notice any color changes to your skin?
I think my skin looks the same, but definitely I notice like my eyes look a little, to me, look a little yellow. Yeah.
Any changes to your vision?
No, no.
Okay. Can you swallow food and drink?
Yeah, that's totally normal. Yeah.
Any trouble breathing, or are you gasping for air? Any shortness of breath?
No, not really.
Any chest pain at all?
No, no.
Any difficulty using the bathroom, urinating?
No, I've been able to go to the bathroom. Only bathroom issue is like the diarrhea. Yeah.
Okay. Do you have any psychiatric history?
No.
Do you have any past medical history that I should know?
Um, Nothing that I can think of. I feel like I'm generally pretty healthy.
Are you taking any medications right now?
No, I don't take anything.
And do you have any allergies to food or any medications?
No, nothing.
Okay. Are you up to date with your vaccines, especially hepatitis A and B? Do you know if you've gotten those?
I don't know. I don't remember.
All right. It's
Yeah.
probably been a while ago, right?
Yeah, I think so. I think they usually give them to you in school, if I'm not
Okay.
mistaken. Yeah, so I don't think anything since then.
No, so you're not sure you've gotten those vaccines?
No, I don't remember.
All right. Did you have any surgeries in the past?
No.
And do you have any family history of stomach issues or any medical histories in your family?
No, I have an older brother and he's really healthy. My parents are fine. Yeah, nothing.
What about any of your families, like grandfather, grandmother, have any colon cancer or any other cancers?
No, nothing. They just died mostly of old age.
All right. Do you live with anyone else right now?
No, it's just me.
Okay. And um, do you do any exercising?
Yeah, I try to go for walks like throughout the week. I work as a pastor, so it's kind of nice to just go out and clear my mind if I need to. But that's about it.
And how would you say your overall diet is?
I try to be pretty healthy. Like I try to eat a lot of veggies. I like seafood and try to eat like lean meat. Try to avoid carbs. So
But you did say that you ate some raw vegetables, right, when you were overseas?
yeah, yeah. I think some of the dishes in there had some of that. So yeah,
Do you drink any alcohol?
no,
Do you smoke any cigarettes or use any tobacco products?
no, nothing.
All right. Is there anything else you think that I should know?
Um, Not really. I think that's mostly like kind of how I'm feeling.
Okay. Um, so I think I'll narrow my differentials. Um, Still the carcinoma of the liver, hepatocellular carcinoma, um, possible GERD, IBS, gastritis, cholecystitis, and hepatitis, specifically hepatitis A. Oh, one more thing. I just wanted to ask, are you sexually active?
No.
Okay. All right. At this time, I would like to do a physical exam. Um, is that okay with you?
Sure. Yeah.
Okay. So can you tell me what is this temperature, blood pressure, heart rate, respiration rate?
So temperature is, sorry, 1 minute. Temperature is 99.8 degrees Fahrenheit, so 37.6 degrees Celsius. BP is 110/80. Pulse is 90. And rest rate is 14.
And is there a pulse ox as well?
No,
All right. And the pain is a 7, right?
sorry.
The pain level is 7?
Yes.
Okay. Can you tell me overall how he looks?
So he looks pretty like a well-developed man, appears to be moderately ill, has that current temperature, but all other vitals are stable. There is some prominent yellow coloring to his sclera and under his tongue. His mucous membranes are moist, lungs and cardiac exam are unremarkable. His abdomen exam reveals normal bowel sounds, but moderate tenderness to the right upper quadrant. Liver edge is palpable just below the costal margin, and his spleen is not palpable. No abdominal mass is palpated, no rebound tenderness or guarding. You do a rectal exam, and he has clay-colored soft stool that is fecal occult blood negative.
Okay, going back to the heart and lung, it's unremarkable when I listen.
Yeah.
Okay, and you said that his eyes and under the tongue is yellow.
Yes.
Okay.
Yeah.
Does he have a runny nose?
No.
Okay, I'm going to look at his abdomen. What do I see in his abdomen? Is there any yellow discoloration in the abdominal area?
No yellow discoloration. Normal bowel sounds.
Okay.
But moderate tenderness to the right upper quadrant.
All right. Are there any? I'm going to palpate the abdomen. Is there any masses?
No masses.
Okay. And the right upper quadrant, the liver edges can be felt when I.
Yes. Yeah. The liver edge is palpable, but not the spleen.
I'm also going to use 2 hands to push up on the right side of the abdomen and ask him to take a deep breath. Does he have any pain when he takes a deep breath?
No.
All right. Is there any edema to the lower extremities?
No.
Okay. I'll narrow my differentials to hepatitis A, any and any carcinoma of the liver, still possible gastritis, but highly unlikely. But mostly, I think my assessment, the history and physical shows some sort of inflammation of the liver, specifically hepatitis A. And my assessment, from my assessment of your history and physical exam, it is likely that you have a hepatitis, specifically hepatitis A. You reported going to overseas and having bouts of diarrhea, which could be caused by the food and the water that you drank, some of the raw food, the veggies there.
Okay.
So hepatitis A is spread mostly by food or drink that are contaminated with the hepatitis A virus. You also describe having stomach pain, fatigue, and fever,
Mhm.
which are symptoms associated um, with the inflammation of your liver. And then
Okay.
upon physical exam, you said your eyes are yellow, um, signifying jaundice, and that happens when the ducts of the liver becomes obstructed.
Okay.
Um, you also had tenderness to the right upper side of your abdomen,
Yeah.
which can be caused by the inflammation of your liver. Um, that can happen when the liver is inflamed and it becomes enlarged.
Mm.
Your temperature was just slightly high, 99.8
Mhm.
today. And that goes along with the inflammation. There are no other masses in your abdomen. Um, and also you did not have any pain from pressing against your abdomen on the right side when you took a deep breath, which may mean that your gallbladder is not inflamed.
Mm.
I think it's still okay.
Okay.
So the plan is that we will order some laboratories for you to check on your liver and also your blood. So we'll order a hepatitis panel.
Okay.
We'll order a complete blood count,
Mhm.
white blood cell count. I mean, white blood cell lab, WBC. Um, and then so there's there's no specific treatment for hepatitis.
Mhm.
We'll manage it symptomatically. Um, Hopefully your body will get rid of the virus on its own, but we can manage your symptoms. For your symptoms of nausea, we can prescribe a medication to manage for that. So let's do a Zofran. Let's do 4 milligram of that every 8 hours if you need it. If you feel nauseated, you can take that, okay?
Okay.
If you are having pain or fever, I'll prescribe you ibuprofen 400 milligram every 6 hours as needed.
Okay.
Um, and then for your diarrhea, we can do a Imodium for you. Uh,
Okay.
when you have your first bout of diarrhea, take 4 milligrams.
Okay.
After that, you can take 2 milligrams after subsequent bouts of diarrhea. All right.
Okay.
Since hepatitis A is a highly contagious disease,
Mhm.
you should not share your food or water with any of your friends or family members.
Okay.
Um, right now, you don't need the vaccine because you already have hepatitis. Well, we don't know for sure you have it or not, but we will check that when your hepatitis
Sure.
panel come. But you
Okay.
can advise your friends and families to get the vaccine,
Okay.
specifically hepatitis A and B, if they do go to get it.
Sure.
Um, you should avoid alcohol, which you don't drink anyways,
Mhm.
and anything with acetaminophen, such as Tylenol, because that can cause more damage to your liver.
Okay.
And then try to get plenty of rest and stay hydrated with fluid for now until
Mhm.
your symptoms resolve, okay? If
Okay.
you do experience like intense abdominal pain or you feel like you're dizzy or confused, or you feel like you're about to faint or having difficulty breathing, any chest pains, please do go to your nearest emergency department.
Okay.
I will follow up with you in 2 weeks when your lab results are received.
Okay.
Okay. Any questions?
No, sounds pretty good to me.
Okay. Well,
Yeah.
thank you, and I'll see you in 2 weeks.
Awesome.
All
Thanks
right.
so much.